Well, the most important thing for post-operative care is to explain to the patient what to expect. They must expect to have pain and they need to take adequate analgesia to cover the pain. The next most important thing to remember is that all wounds will eventually heal, so they don't need to worry about it. Another important thing is that you tell the patients that you're going to review them post-operatively at a certain time. However, if they're concerned in any way, they can always contact you beforehand. One of the problems of doing procedures is availability. If you've done an operation on somebody and then you're not available on the phone for the next week or so and they have a problem, they'll end up in an emergency department somewhere and somebody will treat them possibly differently to what you would like to do. So I think it's important, if you're going to do a procedure, either you're available post-operatively or your practice is available post-operatively if any problems should arise. Patients will often ask us about antibiotics, and we generally tell them it's not necessary to have antibiotics for procedures that are done in the rooms. So overall, the most important thing is explanation to the patient. The most important post-operative complication is infection. These are uncommon, but they do occur, and if they do occur, you can put them on antibiotics, or you may take out the sutures earlier than what you would normally expect because there seems to be some cellulitis around it. The other important thing is if an infection does occur, such as an abscess, it needs to be drained. The other important complication is hemorrhage. So you can get a hematoma under the wound, or the wound can actually bleed despite the fact that you've put pressure on it. And this refers back to being available if something goes wrong.